This week, the DREAMS initiative to combat HIV amongst young girls in South Africa has been launched. The South African government has teamed up with the United States to spearhead this initiative to address the structural drivers of the HIV risk, as well as implementing comprehensive programs for HIV prevention. The DREAMS South Africa plan is funded by the U.S. government's PEPFAR program, the Bill and Melinda Gates Foundation, Girl Effect, and private sector. DREAMS, which stands for Determined, Resilient, Empowered, AIDS-Free, Mentored and Safe, will be implemented in 5 high-burden districts in Gauteng and in KwaZulu-Natal. So this morning, joining us to talk more about this is Dr Aaron Motsoaledi, the Minister of Health. He's in Cape Town at the moment, and in our Pretoria studio, we've got Patrick Gaspard, who is the U.S. Ambassador to South Africa. Thank you so much, both of you. It's wonderful to have you both joining us this morning.
Good morning. I'm actually in Harare.
Oh, I beg your pardon. So you're in Harare at the moment. All right, Minister, thank you very, very much. Then I'm really grateful that you've managed to join us here on the program. Now, what led to the decision to join forces with the United States for this initiative? Minister, I'll aim this at you.
Well, Leanne, we've always worked with PEPFAR, actually. The history of the epidemic in South Africa and involvement of PEPFAR has always been there from time immemorial. And PEPFAR has decided that they will work with us mostly on prevention programs. As you know, in the past, it was mostly on biomedical programs, treatments. So we want to put an emphasis on prevention, because it was found that in Southern and Eastern Africa, the new infection, that means the incidence rate among young girls from the age of 15 to 24, is worrying in Southern and Eastern Africa. That is why this project is being implemented in 10 countries in that region.
Yeah. Let's, Ambassador Gaspard, let's bring you into this conversation. Why was South Africa chosen to be a part of this DREAM initiative?
Well, Leanne, first, thank you so much for having us on. You do such great work in promoting healthcare across this country, so thank you. South Africa was selected for 2 reasons. One, we know that any innovation that takes hold in this country is likely to spread across sub-Saharan Africa, because South Africa's researchers often lead the way on epidemiology. That's number one. Number two, regrettably, despite the wonderful progress that we've made working with one another, there are still over 2,400 young women who are infected with HIV every single week in South Africa. If you're a young woman between the ages of 15 and 19 years old, you are 8 times more likely to be infected than young men of the same age cohort. All of us, including President Obama, thought that was unacceptable and that we needed to do something here and now to focus for impact.
Minister, when we look at South Africa and obviously looking at the effects on women, what do stats say about HIV rate amongst women?
Well, Leanne, it has always been a conundrum, this issue, because as the ambassador is saying, the rate of infection among young women in that age group is 4 times that of young men at the same age group. And it can only explain one phenomenon, which you all know in South Africa, which you don't like, the sugar daddy syndrome. It means these young women are not being infected by boys of their age group, but are being infected by men in what might be some form of transsexual sex, because quite a large number of young girls have lost their parents to HIV. They are orphans, and so they are not really empowered, they are not protected. That's why the DREAMS program wants to empower them, to mentor them, to make them resilient, because many of them are vulnerable to people who will come and say, I'll pay for your airtime, I'll give you money to buy this and that, I'll give you money to do your hair, I'll give you money to eat for food at school, etc., etc. So that type of problem makes young women more vulnerable than young men. at the same age group.
Yeah, indeed. I mean, I think you're speaking the truth. You really, really are, in terms of those scenarios that we see every single day, unfortunately. Ambassador, how much is actually being allocated? I mean, we talk of PEPFAR, we talk about the Melinda and Bill Gates Foundation, Girl Effect, the private sector. What are we looking at?
Well, over the last decade, Leon, I think you know that the U.S. has invested over 70 billion rand in South Africa alone in the eradication of HIV and AIDS. This program will see an additional expenditure of 67 million US dollars here in South Africa between our government, the partnership with the Gates Foundation, and Girl Effect. But I have to tell you, Leon, beyond just the financial investment, what's really important to remember is the empowerment of young women and how they themselves would be the ambassadors for this program. A few days ago, Minister Motsoaledi and I were privileged to join 100 young South African women who were absolutely incredible. They know exactly what needs to be done in the way of microfinance, economic development, and education to turn around this terrible scourge. And I was really inspired and uplifted by their sense of purpose and their determination to bring down HIV infections amongst young women by 25% in 2016 and a full 40% by 2017.
Yeah. Minister, I mean, this is a wonderful injection into the fight against the scourge, as the ambassador called it. What are you hoping to achieve? I mean, what is your vision? What would you like to see and the results being done from this?
Well, as an ambassador, I say, we are hoping to reduce the incidence of infection in that age group, but we are also hoping to see the young women themselves involved in the program, in the programs and the type of things that must happen. But we're also hoping to see the communities there in the areas where we've got this program being empowered. That means we want to find out different communities. For instance, we are dreaming that the NGOs and the CBOs in that particular group should get deeply involved in this program. It's not something that we want to parachute from the sky and say, here is a solution. We want them to get involved so that even if the program is over, they must be empowered. They must show something different from what they've been before the program was implemented.
All right, Ambassador Gaspard, let's leave the final word with you. And just from the US's perspective, obviously South Africa is not the only country that's benefiting from this. In terms of other countries involved and beneficiaries, who are they?
Yeah, there are 10 countries, Leon, that are benefiting from this. 10 countries in sub-Saharan Africa where the HIV transmission rate amongst young women is over 70%. Unfortunately, though, there are 14 countries in sub-Saharan Africa where transmission rates are alarming. Of those 14, South Africa constitutes easily half of all the new infections that come online per week and per year. And that's why we're especially focused here. When President Obama was in Addis at the AU a few months ago, actually last month, he said very clearly that right now in Africa, Africans want trade, not aid, trade that helps everybody prosper broadly. And the Africans that he's met are looking for partners, not patrons. The young women that Minister Motsoaledi and I met with are going to be our partners in turning this around. And an investment in them is an investment in the future of this country, the future of the continent, and the future of the globe.
All right, let's leave it there. Thank you very, very much for joining us here on the program. Patrick Gaspard is the U.S. ambassador to South Africa. And, of course, Dr Aaron Motsoaledi, who joined us on the line. He's our Minister of Health. He's currently in Harare, Zimbabwe at the moment. And we thank you so much for taking the time to be with us here on the program. Let's take a break. News at 7 after this. Stay tuned.